Hello and welcome back to the GYO surgery series. This will be a brief overview of pelvic and paraaortic lymph node dissection. We will mainly be going over the boundaries of these dissections and thinking about how to do one of these pelvic or paraaortic lymph node dissections. And so the overall goal of a lymphadenectomy is to remove all lymphatic tissue from the areas where we predict there can be nodal mets present. We'll start with the pelvic lymph node dissection. The boundaries are, as far as the cephalad boundary goes, the mid portion of the common iliac artery. Lateral is the psoas or genitofemoral nerve, which runs over top of the psoas. The medial boundary is the ureter. The caudad boundary is the deep circumflex vein. And the dorsal boundary is the obturator nerve. And so this is a pretty nice photo here of the boundaries, and so we'll go through each of them. The cephalad being the mid common iliac artery, the lateral, the genitofemoral nerve, and you can imagine that the psoas is running under the genitofemoral nerve just in a way like this. The medial boundary is the ureter, which we can see here coming down medially. The caudad boundary is the deep circumflex iliac vein. And then the dorsal boundary is the obturator nerve. And so you're typically going to try to remove all the lymphatic tissue within these boundaries for your pelvic lymph node dissection. Next, we'll move to the paraaortic lymph node dissection. The boundaries include the inferior mesenteric artery, laterally the ureter, medially the aorta, and then the caudad boundary is again the mid common iliac artery. I have a small asterisk here as far as the IMA goes. The dissection is typically extended to the IMA unless performing a high lymphadenectomy, and in that case, you can extend the dissection to the renal veins, and this would be appropriate in an ovarian cancer staging surgery as well. So looking at this picture, and this is a small excerpt from Up to Date, I think it's a great description, but resection of the nodal tissue over the distal vena cava from the level of the IMA to the mid-right common iliac, and then between the aorta and the left ureter, which is here, cut off, but you can imagine it going down, from the IMA to the left mid-common iliac artery. And so it's basically in this boxed area here that you'll be removing the lymphatic tissue in order to complete your paraaortic lymph node dissection. And these are my references, and in a future video we can go over all of the steps to pelvic and paraaortic lymph node dissections as well. Have a great day.